Nisi. I'm the occupational health nurse at Steel Dynamics Engineered Bar Products Division in Pittsboro, Indiana. We're going to talk today about medical emergencies and oxygen therapy. So I just wanted to kind of start out with this very first slide here. What do you see? The most important thing about to be a medical responder, the most important thing that you should always ask yourself is the scene safe? So you're called, you get a call on the radio that says, hey, we've got a man down, needs some help. Our first instinct is to run in and go help our coworker. But we need to pay attention as we're running in. We need to be aware. So if you look at this first slide, this was a horrible accident that happened several years ago. But you'll notice that these girders actually fell and they landed on someone. But one of the first things that you should notice is, as you're coming up to a scene, is this scene safe? So is the equipment secure? If I'm going to go into the next, to go into this scene to help someone, what I can do to make sure that I'm not the second victim. So always keep that in mind in anything that you're doing in taking care of a person or a coworker. You'll see in this next slide here, though, how everything is all tied up and secured, and that's what you want to see before you go in and help someone, that scene is safe and it's okay for you to be able to go into a situation. So some general approaches to a medical patient. The first thing whenever you get the call on the radio, like we were showing, is the scene safe? Then you want to make sure, do they have an airway? Are they breathing? Do they have a pulse? If you walk up to someone and they say, hey, are you doing okay? And they're saying, my leg is trapped. Well, they have all three: airway, breathing, and circulation. So your initial assessment begins with A, is that scene safe? Then it begins with the ABCs: airway, breathing, circulation. Is there any bleeding that needs to be stopped quickly? After that, ask the person what is wrong. You want to try to figure out what their chief complaint is. You want to be as calm as possible in the event of an emergency. If you don't know what to do in this situation, just stay calm, keep quiet, listen to what they have to say, and rely on your fellow coworkers who are also first responders. I tell my people down at my facility, when in doubt, one thing that you can do is give oxygen. Oxygen is a medication or a drug that we can provide that just helps people calm down in the event of an emergency, and it makes the injured person feel more comfortable that help is on the way. So many of the facilities, we give oxygen. You have an oxygen tank. The first thing you want to do is you want to crack that tank open. And always remember the mnemonic, lefty-loosey, rightsy, tightsy. There's a regulator valve on it. That regulator valve will indicate how much oxygen is in the tank. You will attach the tubing that has either a nasal cannula or a non-rebreather mask, and then place the mask upon the patient. There are many parts of the oxygen tank. You've got your regulator, you've got your flow rate valve, you've got the nozzle, and then the washer that goes in between the oxygen tank itself and the regulator. So you always have to be very careful with proper storage with oxygen. You always want to leave it laying down on its side. Never leave it by itself standing straight up, because if that happens and it gets knocked over, it could explode. So proper care of your oxygen tanks is very, very important in the scene of an emergency. Remember that oxygen is highly flammable, so it's very important that there's no smoking, no sparks, no flame nearby when you're using it. Some common mistakes with using oxygen is you're not opening the valve completely. You didn't put the regulator on tightly enough, so you're getting leakage of the air. The washer that goes between the regulator and the tank has been removed. Remember, it's very important to keep it laying on its side. And you put the wrong amount of oxygen for the mask. So some oxygen delivery systems, we use a nasal cannula, which delivers low dose oxygen. That's what you see goes up into people's nostrils. The cannula points up towards the nose, and you would use that for medical emergencies such as chest pain, heat stress, possibly a stroke, somewhere where people may tolerate a little bit of oxygen, but they don't want their face covered by a mask. A non-rebreather mask gives you as close to 100% of oxygen as possible. You would crank the regulator up to 15 liters per minute. You place the bag or the mask over the face once the bag has been inflated. And you use these for any traumatic emergencies, if the patient is unconscious, any type of serious injury where you're not able to awaken the patient. Nasal cannulas, you only use anywhere from 2 to 6 liters of oxygen. Like I said, that's for low dose oxygen, and you would do that in somewhere where somebody is still able to talk and maintain a conversation. Another important thing when assessing your patient, remember we've assessed the scene. Is the scene safe? We've checked that they have their airway, their breathing, their circulation. We've checked what their primary complaint is you want to check their mental status. If you see someone that's been hurt pretty significantly, whether they've been hit in the head, they have a traumatic issue, it's very, very important to assess their initial level of consciousness. When you come up on the scene and you're the first person on the scene, are they able to answer your questions appropriately? Do they know who you are? Do they know what's going on? Or are they groggy? Are they hard to arouse? Do they not really know where they are or what day it is? And then after that, you want to constantly reassess to make sure, are there any changes in that level of consciousness? Because that will tell you a lot about how your patient is doing. And that's very important things that you want to relay to the paramedic once they get on site. Some causes of decreased level of consciousness are person's had a head injury, they've been hit in the head. They're bleeding excessively from somewhere, so they're going into shock. They may have some decreased oxygen to the brain, whether it be from a stroke or other issues. They could have a very, very high fever or an infection. Decreased levels of consciousness can occur in people that have diabetic emergencies or go into insulin shock. You can get it from drug overdose, any type of poisonings, carbon monoxide poisoning, alcohol overdose, and psychiatric conditions can also cause that. So some of the medical conditions that we do come across, seizures would be one, and what seizures are random shaking movements that involve the entire body. They are very unconscious movements. The person cannot control them at all. They will last less than 5 minutes. The person that is suffering this is usually unconscious during the event and then has no recollection of it afterwards. It's not a life-threatening condition, however, it can be a sign of a life-threatening condition. Some causes of seizures, number one is epilepsy. That can be something that somebody is born with or they've developed it as a result of a accident or other issues. Trauma, head injury, shock, stroke. They can have, like I said, the decreased oxygen to the brain. Some children will get a high fever and have a seizure. Brain tumors can also be another sign of people having seizures, diabetic emergencies, and sometimes we don't know why somebody has a seizure. Treatment of seizures. Protect the patient. That is the number one thing you need to do, is protect the patient. Don't try to restrain them. Don't try to hold them down to stop their seizures. Only move that patient if they are in a dangerous location. You want to monitor the airway, but you don't want to insert anything into the airway to make sure it stays open. You want to call the ambulance to come and pick this person up. After the seizure, the person is going to be amnesic. They're not going to know where they are. They may have lost their bowel or bladder control. You want to lay them on their side in the recovery position. Sometimes they get sick to their stomach. And you want to monitor, again, their airway, give them some oxygen as they start to wake up and come around. Stroke is a leading cause of brain injury in adults. You may you've heard of people say strokes are a heart attack of the brain, because typically strokes are caused by a blood clot going into the brain and cutting off the blood supply to that area of the brain. So some signs and symptoms of stroke. We've all heard the mnemonic FAST, F-A-S-T, facial droop. Ask the person if they can smile, show you their teeth. Arm weakness. See if they can hold their arms up, or if one arm is weaker and drifts down. Ask them, speech, ask them to say something like the sky is blue. If they have trouble with any of those, then it's time to call 911. Other signs and symptoms of stroke could be headache, numbness or paralysis on one side. They may be dizzy or confused, may be drooling or have an inability to speak. They're having difficulty with their vision and able to see things up close or far away. Their pupils may be unequal in size. One pupil might be much larger than the other. They could be unconscious. They could be having a seizure. Might be in respiratory arrest, so they may not be breathing, and they may be incontinent. So treatment of stroke is to maintain their airway, give them high-dose oxygen, and promptly transport them to the hospital as quickly as possible. The sooner that you recognize the symptoms of stroke, and the sooner that you can get them to the hospital, the quicker that they have that, there's like a 3-hour window of time where they can get onto some types of blood thinners and medications that will help reverse or minimize the effect of the stroke on them. Diabetes. Diabetes is caused by the body's inability to process and use sugar. There are 2 types of diabetic emergencies: diabetic coma and insulin shock. We are probably going to see more cases of insulin shock in our areas rather than a diabetic coma. Insulin shock is a life-threatening emergency. What it is there's too much insulin in the body, and there's not enough blood sugar to the brain. The brain requires blood sugar to think and work. And so think of it as an engine that has run out of gas. So if there's not enough sugar and there's too much insulin in the body, the person is going to become weaker and weaker. It can be signs and symptoms of traditional shock. They can be unconscious, have a low blood sugar or low blood pressure, and a high heart or fast heart rate. Questions to ask to a diabetic: did you take your insulin today? Have you had anything to eat? And it's very, very important, if they are able to speak, to find these things out. And always remember that insulin shock is a life-threatening emergency. Diabetic coma. Diabetic coma is the body has too much sugar and not enough insulin. So in these cases, the person can become very sleepy. They may appear to have a severe cold or the flu, and they have like traditional, almost flu-like symptoms. So some common differences between insulin shock and diabetic coma. Insulin shock, like I said, that's going to be traditional shock symptoms. They're going to have pale, moist skin, a weak, rapid pulse, normal breathing. They may be confused, a very decreased level of consciousness. They may be very combative. And the symptoms can come on rapidly. So you may be talking to the person and they can be just fine, and then the next minute they can become very combative, very out of it, very weak, and confused. For a diabetic coma, these individuals have warm, dry skin. They may have a very rapid pulse. They have this deep, rapid breathing, almost like they're hyperventilating, because they're trying to blow off the ketones and the blood sugar in their body. They could be unresponsive or unconscious. These will have a very slow onset of symptoms, whereas the insulin shock, their symptoms come on very quickly, and they have a very fruity smell to their breath. Treatment: give sugar by mouth if the person is not unconscious. This is for insulin shock. Prompt transport to the hospital. You can do an AccuCheck on the scene depending on the time if there's one available, so it gives you an idea of what the blood sugar is. So we're going to talk a little bit about heat stress, because heat stress is also a medical emergency. So heat stress is a very serious illness or injury, but it's also 100% preventable. It's your body is this amazing machine, and it wants to keep your temperature somewhere between 97 degrees and 98 degrees. So you shiver in the winter when you get really cold, and you sweat in the summer when you get really hot. What is happening in heat stress is that you're overworking the cooling mechanism in your brain, and so your body is starting to generate and build up more heat, and that is what is causing issues. Some symptoms of heat stress: the number one sign or symptom of heat stress is a headache. You get it right behind your eyes. It is the very same headache you get after a night of drinking. It's a dehydration headache. Other symptoms include fatigue, weakness, maybe sick to your stomach, impaired judgment. You're just not thinking as clearly. Low blood pressure. If you bend down to pick something up and you stand up and you get kind of that head rush or that tunnel vision. Rapid pulse. Rapid breathing. You know how a dog pants in the summer when they get too hot? Well, we do the same thing when we're suffering from heat stress and we're trying to blow off the excess heat. You may have profuse sweating and cool, clammy skin. Treatments of heat stress is to move the person to a cool, air-conditioned location and stay with them. So move them out of the heat into the pulpit, take off their outer jackets or outer clothing, put wet towels around their neck, on their head, under their armpits, pour cool water on them. Give them water or some Gatorade electrolyte replacement drink to take, and call for a first responder or a nurse in your area. It's very, very important to remember that if somebody's gone down with heat stress or heat exhaustion, you can't just say, here, drink these 4 bottles of water or 4 bottles of Gatorade quickly and get back out there. These people are very, very sick, and it is a slow recovery. So you are going to have to spend time slowly giving them fluids to drink because their stomach's going to be upset, and if you start to give them more fluids to drink and their stomach gets upset, then you're back to square one. And the most important thing is to help rehydrate the patient. You may also give them oxygen by nasal cannula to give them a little bit of oxygen as they continue to rehydrate. You can give some electrolyte tablets if you keep that at your facility. They may be released to go home once they have been able to go to the bathroom on their own. So up until that time, and this will take about 2 hours or so, so it's important to slowly rehydrate someone, and they can't be released to have someone come and pick them up until they are able to void on their own. Asthma, that's something else that you may see out at your facilities. It's a spasm or a constriction of the smaller airways of the lungs. When someone is having an asthma attack, they may have very labored breathing. It can be anywhere from mild to severe. It can be triggered by environmental issues or stress. And you'll see when people are having an asthma attack, they are using every muscle in their chest and in their body to breathe and try to get that air out. Most asthmatics carry their inhalers with them, or they have them in their lunchbox. So go up to your coworker and ask, are you having an asthma attack? If they say yes, say, do you have your inhaler with you? And if they do, ask them where to go get it so that help them use it. Give them high-dose oxygen if necessary, and prompt transport to the hospital. Anaphylactic shock, we have many people that are allergic to bee stings or peanuts, and so they carry the EpiPens with them. An anaphylactic shock is a severe allergic reaction that occurs when someone is exposed to a substance. The reaction can develop in minutes or seconds after contact with that substance. So signs and symptoms are a flushing of the face or the upper chest. They may have hives, swelling of the face, tongue, or lips, bluing, which is called cyanosis of the lips. They may be sneezing. They could have tightness in the chest with a persistent cough, wheezing or difficulty breathing, blood pressure drop, or a weak fast pulse. Treatment is you're going to call 911, ask, do you have your EpiPen in your lunchbox? If they do, you can go get it and administer the EpiPen. Remember, you would take the EpiPen and you can put it right through the clothes, right into their thigh, hold that for a count of 10, and then you can give a second dose of Epi if there's a second pen available in 5 to 10 minutes if the ambulance is going to be delayed in picking up the patient. Chest pain. Chest pain, the person will come in and say, I feel like I have an elephant sitting on my chest. I feel this tight band squeezing around my chest, or it's crushing. They may be short of breath, they may be sweating, maybe sick to their stomach. They may talk about the pain radiating up to their shoulder, down their arm, in their neck or jaw, or between their shoulder blades. They may have a sudden onset of weakness. Treatment for chest pain is you're going to call 911, give the employees some oxygen, give them 4 baby aspirin to chew, stay calm. You want to make sure you always have your AED nearby in a situation where someone's having chest pain, and prompt transport to the hospital.